Hey there, and welcome back to the channel. Today, I'm going to be diving into a fun and fascinating topic: how to tell your baby's sex on the ultrasound. Whether you're anxiously waiting for that big reveal, or maybe you're just curious about the science of how we figure this out on ultrasound, well, I've got you covered. If you're new here, I'm Dr. Christina Pinnock, and I'm a board certified OBGYN and high risk pregnancy specialist, and I share videos to help you have a healthy and enjoyable pregnancy. If you haven't yet subscribed to my channel, do me a favor and hit that subscribe button. This will help my channel to grow and reach other women like you. Also, you can get more pregnancy tips straight to your inbox with my weekly newsletter at healthypregnancyafter30.com. Now, let's break down how to tell the sex of your baby on ultrasound. Before we delve into that, let's talk briefly about how early you can tell the baby's sex. So many parents now, with the NIPT blood tests being more widely available, usually know the sex of their baby sometimes before the first ultrasound, but even before the anatomy ultrasound, which is your big ultrasound that you get in pregnancy. But even with this NIPT blood test that's available, we always still have to confirm whether the genitals of the baby appear to be male or female on ultrasound. Now, when you think about ultrasound confirming the sex of the baby, parents can confirm the sex or find out the sex generally at the mid-pregnancy anatomy scan, which usually happens between 18 and 22 weeks. This is when the baby's genitals are really fully formed and visible on ultrasound, but you can actually sometimes tell the sex earlier in pregnancy if the baby's positioned just right. I know, it's crazy. I always get shocked when I'm able to tell. All right, but there's one thing to keep in mind with that. Early guesses about the sex of the baby aren't always accurate. And so the best window for confirming the sex of the baby on ultrasound is still around that 20-week mark, when everything is more clearly defined and developed. Now let's switch gears and review how we can tell on ultrasound if it's a male or a female in terms of the sex. So we'll get technical for a minute, but just stay with me, okay? When we're trying to determine the sex of your baby, we're actually looking at a few key things on ultrasound, and what we look for in ultrasound will really depend on how far along you are in pregnancy. So if you're in the first trimester, so you're getting an ultrasound, say between 12 and 14 weeks, we're looking at something called the genital tubercle. Now, early in pregnancy or early in development, both male and female sex have a very, very similar structure called the genital tubercle. And this tubercle is a small bump that we essentially see between the baby's legs, and it'll grow into either a penis or a clitoris. On ultrasound, we look for this area, and if the little nub points at an angle of around 30 degrees or more, so more facing up, then we can fairly confidently say that it's likely a boy. But if that area is more flat or parallel to essentially the spine of the baby, then we think it's more likely to be a girl. This is just a theory and it's not a foolproof method, but in the early first trimester ultrasounds, that's essentially what we're looking for to determine if it's a male or a female in terms of the sex. But after 20 weeks, we actually look on ultrasound for the specific genital parts for each sex. So to make it easy for you to understand and remember, I'm going to use two sort of funny nicknames for what we're looking at your 20-week ultrasound that essentially will help us to determine if it's a male or a female. So for females, we look for something called the hamburger sign, which is essentially three little white lines right between the leg area that represent the anatomical structures of the labia and the clitoris. While for male sex, we call it a turtle sign, which essentially is an appearance of the penis and the scrotum that resemble, well, really kind of a turtle sticking its head out. So that's where we come up with those names. But essentially, we're looking for directly those specific genital structures that anatomically correspond to either a male or a female on ultrasound. And the best time to really do that is really at that anatomic survey between 18 and 22 weeks. As I mentioned before, during early pregnancy, we may not be able to say the sex of the baby with certainty, but with the anatomy scan, we will for sure be able to confidently say whether it's one way or another. And in some rare instances if we have concerns about how the genitalia develop. Here's the thing though, your baby doesn't always easily show us the genital area. If they're curled up, facing the wrong way, crossing their legs, it can make it tough for us to tell the sex. So if your ultrasound technician asks you to shift positions or even asks you to take a brief walk, they're really trying to get a better view of that area. So bear with us. It really just depends on baby's position. But generally at that ultrasound, we want you to walk out confidently, knowing one way or another if it's a male or a female sex. Let's briefly talk about some things that can actually impact the accuracy of us evaluating the sex. There are a few things that can affect whether we get a clear determination of your baby's sex. And I'd say the gestational age or how far along you are in the pregnancy is the main one. So as I said earlier, scans in the first trimester are not as accurate, but the closer you get to 20 weeks, the clearer the picture. Another thing that determines whether or not we can accurately see that area is the type of ultrasound equipment that's being used. Now, high-resolution machines can give us a more detailed view of your baby's anatomy, and so that's why generally that 20-week scan is more reliable because it's generally performed using a high-resolution ultrasound machine. Now, another factor that can impact the accuracy of the results is based on the experience of the sonographer or the ultrasound technician doing your ultrasound. Generally, I'd say it's pretty standard for most people to be able to visualize and know whether or not it's a male or female, but that's something that could be a variable. And then, as I mentioned before, your baby's position could also delay the reveal, but generally we're able to tell once baby turns over. Now, I do want to share with you, as a high-risk OBGYN, some fun stories that I have seen in the ultrasound unit with babies and the things they do to hide from us. There was one time that a couple was so excited to find out whether they were having a boy or a girl, and I think they were really hoping for a girl. And right when the technician and I were about to point out the area, the baby literally just flipped over like they were saying, "Oh no, enough." And so it can be really cool to see that babies sometimes have their little personalities even while in the womb. So some really fun experiences there. And I've also heard of a few different ways that many women have shared with me about them guessing for the sex of the baby that are generally myths, but I did want to share a few of them with you that are common that I hear. The first one that I hear the most is that if the baby's heart rate is above 140 beats per minute, that means it's a girl. And if it's below 140 beats per minute, that means it's a boy. Unfortunately, this is not true. The baby's heart rate can actually fluctuate during pregnancy. A normal range anywhere from like 110s to 160s is normal. And so the heart rate is not related to the baby's sex. It's more influenced by, the baby's age, the activity level of baby, and some other factors. But unfortunately, we can't use the heart rate to determine the sex. That one is just a myth. Another one I sometimes hear is if the placenta is on the right side of the uterus, then it's a boy. And if the placenta is on the left side of the uterus, then that means it's a girl. Similar to the heart rate fluctuations, we can't really use the location of the placenta to determine the sex of the baby. It has not been shown to correlate with the baby's sex. I just share these myths because, they're kind of fun to discuss, but overall, the most reliable way to determine the baby's sex is at that ultrasound between 18 and 22 weeks. And even if you get your genetic testing with the NIPT, then it's still advisable or still needed to take a look at the genital area. Now, there's some instances where some families, and you may be one of them, don't want to know the sex of your baby. And that's perfectly okay. So when you do go for your ultrasound, just let the sonographer know that's doing your ultrasound ahead of time that you don't want to know the sex. So they'll be careful not to spill the beans. And instead, they'll just focus on checking that everything looks healthy and on track, and they'll keep that part of the ultrasound results private for you to respect your wishes. I did want to leave a few tips for you about navigating pregnancy, especially over 30. And the first one I did want to leave is to just stay informed. Knowledge is power. You can always ask your doctor about your ultrasound results, what they mean for you and your baby. And it's important to just make sure you leave every encounter just understanding what's going on. The second tip I want to leave for you is just to focus on the bigger picture. So whether you find out the sex of your baby early or whether you wait until the baby's born, remember that a healthy baby is really the ultimate goal. And so, really focusing on the big picture is something that's really important. And then lastly, I always like to say, just enjoy the journey. Pregnancy is a really, really special time and it can be full of surprises. So I always encourage my moms to just embrace the little moments, like watching your little baby, flip and squirm on the ultrasound screen when you can. That's everything that I wanted to share with you about how to tell the sex of your baby on ultrasound. So thanks for joining me today. If you found this video helpful and enjoyed just learning about, this topic, don't forget to share it with someone who may be interested, and also hit that subscribe button to help me grow my channel and reach other moms just like you. Also, if you do want to get more pregnancy tips directly to your inbox, go ahead and check out my weekly newsletter at healthypregnancyafter30.com, or you can find it at the description box below. As always, I love to hear from you. So if you have any comments or you want to share how you found out your baby's sex, go ahead and share it in the comments below. And I'll see you next time. I look forward to hearing your stories.